Assalamu alaikum. Welcome to the new video series of Let's Diagnose ECG Quiz First. इस वीडियो में हम पहले ECG को एनालाइज करेंगे एंड देन उसे एक्सप्लेन भी करेंगे, सो वीडियो को एंड तक जरूर देखना. So let's get started. So our first case is here. A 45 years old female comes to her cardiologist for the first checkup after implantation of a pacemaker. So हमारे पास अब चार options है: atrial pacing, atrioventricular sequential pacing, right ventricular pacing, His bundle pacing. Before I interpret this ECG, pause the video and try to interpret it on your own. The heart rate is 74 beats per minute. Rhythm is regular. The QRS complex is upright in lead 1 and downwards in lead 3, which shows left axis deviation. Pacing spike can be seen that precedes each QRS complex. The QRS complexes are broad or widened and look similar to left bundle branch block. Also, we can see here that the major portion of QRS complex is located on the opposite side of baseline from the ST segment and T waves. In summary, this ECG shows right ventricular pacing as given here as third option. So let's check our answer. It's correct. अब हम इसे और एक्सप्लेन करके देखते हैं. Right ventricular pacing is a medical procedure used to treat certain heart rhythm disorders, particularly when the heart's natural electrical conduction system is not functioning properly. To understand this, let us see the conduction system of heart, which consists of SA node, AV node, bundle of His, right bundle branch, left bundle branch, and Purkinje fibers. Right ventricular pacing involves placing a pacing electrodes or leads into the right ventricle of the heart, usually through a vein. This electrode is connected to a pacemaker, which is a small device implanted under the skin, typically in the chest area. The pacing technique can be illustrated here using this figure. First one shows atrial pacing, second one shows right ventricular pacing, which we are discussing here in this video. Third one shows bundle of His pacing. Fourth one shows left bundle branch area pacing. Fifth one shows biventricular pacing with an epimyocardial left ventricular lead via the coronary signs. Now let's summarize the ECG changes associated with right ventricular pacing, which include widened QRS complexes often resembling a left bundle branch block pattern, and T-wave changes, loss of R-wave progression, and pseudo-infarction patterns may also occur. It should be noticed that the physiological QRS axis may be altered. Interpretation should consider pacing site, underlying pathology, and patient characteristics. Now here at the end is another example of right ventricular pacing ECG. The underlying native rhythm is probably chaos atrial fibrillation. There are several possible waves visible in lead V1, but otherwise the atrial activity is chaotic.
Subscribe, learn with SD, and press the bell icon. Don't miss any update. If you like the video, please share with your friends.